Good morning, and thank you very much for having me and my colleague Daya here today. And as our MC mentioned, my name is Julia Smales, and I'm the manager of the clinical services team in the mental health branch at the Ministry of Health. And together with Daya, we work on the mental health peer workforce program. I want to acknowledge, firstly, the traditional owners of the land on which we're meeting today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present, and emerging. I acknowledge the lived experience of those with mental health issues, whose preferences, wishes, needs, and aspirations are at the heart of all the work we do. And I also acknowledge the families and carers of all people with a lived experience of mental health issues. New South Wales Health has identified the peer workforce as a priority area for reform and workforce growth. As you can see, there are several key documents guiding the development of the peer workforce in New South Wales, including the 5th National Plan for Mental Health and Suicide Prevention. Living Well also promoted the development of the New South Wales Strategic Framework and Workforce Plan for Mental Health, with actions around peer workforce development, and Living Well in Focus continues to promote and support the development and growth of the peer workforce. As I stated earlier, the peer workforce was included as a priority workforce in the workforce plan. Some actions include collecting peer workforce data through routine reporting, and we have recruited and trained new peer workers via the peer-supported transfer of care program, or otherwise known as Peer Stock. And this program, as you may know, provides peer support to people who are being discharged from hospital, beginning with in-reach into hospital prior to discharge, and continuing the support and connection to assist people to transition back to home and into their community. We also provide support to senior peer workers, particularly from Daya, in districts and networks, and these peer workers are critical to provide guidance to peer workers and new peer workers in frontline services. Work is progressing on the New South Wales Peer Workforce Framework, which will guide development of and support for the peer workforce. The project objectives are to work with all districts and networks to develop mechanisms to support peer workers in public sector services and improve role clarity, define scope of practice, and articulate professional development. We have already established an expert reference group, which includes peer workers, clinicians, and managers. And wide consultations through surveys and interviews are being planned for later this year. And I'm now going to hand over to my colleague Daya to take you forward into more detail about some peer workforce initiatives. And thank you again for having me.
Thank you, Julia, and it's lovely to see all of your faces today. I think this is probably the longest in my memory anyway between forums that we've had, so it's fantastic to see you all. The last time we were here, we were sort of in the middle of bushfire response, and then not too long after, we jumped into a global pandemic. So it really is quite a feat for all of us to be here today in person. So we are very much looking forward to starting consultations in the second half of this year around the framework. So as Julia mentioned, that will include survey, interviews, and also workshops. So more information to come out shortly about that. So I thought I'd quickly run through a couple of the programs and roles that are directly funded by the ministry, particularly for people who are new to the peer workforce. So we have, obviously, districts and networks also fund additional positions through their core funding, and we are seeing a greater allocation of core funding to peer work roles. So it's useful to highlight some of the new initiatives that have rolled out since our last forum. So that includes the Towards Zero Suicides initiatives, as well as COVID-19 enhancements. So the most relevant programs for New South Wales Health are the Alternatives to Emergency Departments, or the Safe Haven Cafe initiatives, as well as the suicide prevention outreach teams. And some of those were mentioned yesterday in the LHD presentations. And so it's important to note that there's up to 70 FTE peer work positions through the Towards Zero Suicides initiatives that have been funded across the state. So that's quite a massive increase to our peer workforce over the next sort of 12 months. We've also seen additional peer work positions created through the COVID-19 enhancements for additional support during the pandemic. So that funding will be ending on 30 June, but I'm aware some of the LHDs have also extended contracts around the COVID-19 enhancements. So we've also seen more of an emphasis on what I'm calling sort of specialised mental health peer worker roles. So that includes in the older person space, the young person space, and Aboriginal identified positions. And as well as specific roles funded through drought peer work, so through the Farmgate program, which I believe Butch will be talking about a little bit later on today, as well as through PCLI, the Pathways to Community Living initiative, as well as starting to see some perinatal mental health peer worker roles. So we are really seeing the expansion of the peer workforce over time. I thought I'd also mention in regards to the Peer Stock program, which many of you are aware of, we've also commissioned an independent evaluation of Peer Stock through the University of Sydney, which includes lived experience researchers and a lived experience advisory panel as part of that evaluation, and that's due for completion later this year. So that'll really help to grow the evidence base in New South Wales around peer work. So this is a bit of a busy slide, but I thought I'd just show you some of the things that we are doing across the state and some of the enablers and support for peer workforce development through the ministry. So my role was created in 2016 to provide statewide guidance and advice. And we also have several committees that support peer workforce development. That includes, of course, the New South Wales Consumer Peer Workers Committee, which has been going for over 20 years now. We also have the Consumer Subcommittee, which reports up to Mental Health Program Council, and that has quite a strong peer worker representation on that committee. And we also have the Peer Stock Advisory Committee, which provides support around implementation of the Peer Stock program and includes peer stock managers and peer workers. Many of you will also be aware of the Mental Health Coordinating Council Cert 4 Scholarships program. So that improves access to the Cert 4 mental health peer work by reducing financial barriers for peer workers to access the Cert 4. And this year we also have an additional component of the scholarships program, which is a training component to support experienced peer workers to become qualified peer trainers in Cert 4, so through doing the Cert 4 in training and assessment, as well as receiving mentorship through a qualified peer trainer. So we really wanted to ensure the sustainability of the Cert 4 in New South Wales over time, and to ensure that we had peer workers teaching the Cert 4. We also provide funding to Being to support peer workforce development. So that includes co-hosting this forum with CPWC, as well as they've developed a peer supervision training model to ensure peer supervisors can access training in this area. So we heard quite a bit about that from Irene yesterday. So really looking forward to seeing that rolling out and get going. And we're also looking at options to ensure intentional peer support training is rolled out to the workforce. So very quickly, because I'm sure we're almost out of time, I thought I'd quickly touch on the data around peer workforce and how much growth we've seen lately. So we currently have 150.4 FTE peer work positions as at March 2021. So in the 150, that may include some of the suicide prevention peer worker roles that have just been recruited to. And there's about 30 FTE within the Peer Stock program specifically. So that's an increase. Last year we were at about 111 FTE, so we've seen quite an increase in the last 6 to 12 months in the peer workforce. And this is reported through on a quarterly basis for all of mental health peer workers and a 6-monthly basis for the Peer Stock program. So I thought, and that's my face up there, so a bit of self-promotion going on there. So I thought I'd also mention some of the resources that are available for people to access. So as we know, organisational readiness is a really important part of peer workforce development and supporting the peer workforce. So having some resources available for employers and managers to access is really key. So the Peer Work Hub, which many of you would be aware of, which is supported by the New South Wales Mental Health Commission, has a whole bunch of resources available for managers as well as peer workers. Includes things like useful recruitment strategies, how to appropriately interview for a peer worker role, the importance of peer supervision and reasonable adjustments. The New South Wales Mental Health Commission, the Ministry and the Consumer and Carer Peaks, being in Mental Health Carers New South Wales, collaborated on some new video resources last year which are now on the website. So feel free to check that out and share them with your colleagues. And before I finish up, I thought I'd also quickly mention some new documents or frameworks that you might be interested to hear about. So we will also have the launch of the South Eastern New South Wales Peer Workforce and Lived Experience Workforce Guidelines next week. So I thought I'd just quickly mention that because I haven't heard that mentioned this week. So keep an eye out for that coming up next week. And there are our contact details if you need to get in touch. Before I finish up, noting that we haven't been together for a little while in the last 18 months, I wanted to thank each and every one of you for the tenacity that you've shown over the last 18 months. We've all had challenges to contend with. We've had bushfires, we've had floods, we've had a global pandemic, and that's really significantly changed the way that you work and the way that you provide support to people. I really wanted to thank you for the dedication that you've shown, the flexibility and the ability to innovate that you've all shown during this time. I think that's really touched me in a lot of the stories that you've been able to share with me around the ways that you've had to change the way that you work is really inspiring. So I wanted to really thank you for showing the sector what peer workers can do and how to provide support to people during times of distress. So I hope the next year is kinder to all of us, and I hope that it's not almost 2 years in between us getting to catch up with each other face to face. And I really look forward to seeing all of the work that you continue to do in the districts and networks over the next year. Thank you very much.